following China dropping its zero COVID policy, there's now been some pretty serious concerns over that country's ability to deal with the outbreak. And we all know what happened when this started and we had Wuhan. So after sustained pressure, the notoriously secretive Chinese Communist Party, they've now released the death toll. And wait for it, this is really going to knock your socks off. 60,000 people have died of COVID-related deaths in just over 4 weeks. 60,000. And while the ongoing lockdown was never sustainable, the Chinese now seriously need, I think, to figure out a way to bring these numbers down. Joining me now is infectious diseases expert Paul Griffin. Paul, thanks very much for your time. Do those numbers surprise you?
No, they're not surprising, really. I mean, we know when COVID first goes through a population, when they open up from a zero COVID policy or similar, the case numbers will be very high. And unfortunately, particularly if there are low vaccination rates, well, then the death toll will also be high. And, you know, one of the criticisms has been a little bit of a lack of transparency. So it is good to get a handle on some of these figures. And yes, it is a very large number. And so more needs to be done to try and slow that down.
What do we know about the vaccination levels in China itself?
Yeah, unfortunately, they're not where they need to be. And I think those figures demonstrate that they haven't achieved the same high rates of vaccination that, for example, we have. And that the vaccine that they've relied on most is perhaps not as effective as the vaccines we've been fortunate to have. So those facts, as well as a few other issues, have been what's really led to such a high death toll and such a big impact at the moment.
So when you look back at the history of this, and I mentioned Wuhan, obviously they got to a point where the Chinese population, Paul, started to rebel against being locked up. We saw those images of people breaking out of places like Disneyland. And so were the Chinese government right to be as strong as they were, given the low vaccination rate and given their huge population and the understanding that this would spread like wildfire if it got out?
Look, it's challenging. There's no perfect way of managing this virus. That's what it's shown us, I guess. But, you know, it was a good idea to try and limit spread. That's very clear. But there's only so long that people can do that effectively, particularly when we look at the more infectious Omicron variants, for example. So, you know, the ideal situation is to use that time that those strategies buy you to ensure that you're well prepared. High vaccination rates, procuring antivirals, making sure there's a health system that's ready. And when you do open up, making sure that it's not a so-called let it rip strategy where you just abandon all measures. You still need to do things to slow the spread, like trying to keep people who are unwell at home, having high rates of testing, for example, etc. And so, you know, I think their strategy was one that worked there for a period of time, but was inevitable that when they opened up that the case numbers were going to be high. And unfortunately, I just don't think those preparation measures were quite where they needed to be.
A lot of the Chinese victims were in their 80s, 80 or older. That's probably consistent with the rest of the world, is it?
Yeah, that's right. We know age is a very big risk factor for more severe disease, and that's why making sure that you have very high vaccine coverage in the elderly and those with medical problems is a really good strategy to minimise the impact. And it appears that the vaccination coverage in the elderly just, you know, once again, wasn't where it needed to be to limit the number of people that unfortunately don't survive being infected with that virus over there.
So how worried should we be as Australians? I mean, I flew internationally a week or so ago, and I noticed on tarmac, both in New Zealand and here, Chinese aircraft that obviously are flying in and out of Australia and tourist places in New Zealand. How worried should we be about this? Is it a new strain coming in? Should we be concerned again?
It's obviously a terrible situation there. It'd be great to see that situation get under better control and that death toll be reduced. But I don't think there's a high probability of a significant impact of that here. You know, we know that we have a lot of COVID cases in our country, and most of the rest of the world has a high number of COVID cases as well. So, and we know that new subvariants arise randomly, like we're seeing XBB 1.5 in the United States, for example. So I don't think just because there are a lot of cases there that the next subvariant that worries us is necessarily going to arise there. And people can get infected with COVID in Australia right now just as readily as many other parts of the world. So while I think it's good that we try and get more data from China to understand the situation and continue to observe closely, I don't think there's a high probability that that's going to have a direct impact on Australia.
Are you worried about what's happening here right now?
Oh, look, I wouldn't say I'm worried, but I do think we need to do a little bit more to make sure we keep the upper hand with COVID. I mean, we have amazing tools in this country. We're fortunate to have vaccines and antivirals that, for example, aren't necessarily available over there in China. But I don't think we're utilising those to their fullest capacity. We need to make sure people are boosted and up to date with their vaccines. And we need to make sure we find cases and get antivirals to those people that are eligible, and still do some basic measures to limit spread, like encouraging people who are unwell to stay home till they're no longer infectious. And I think there's a general perception here at the moment that COVID's over and we celebrate being past the peak, but we know it's not going to go away, and we just need to get those basics right.
You expect a spread after Christmas?
I think we're going to continue to see this virus spread, even though we're past the most recent peak. It doesn't mean the virus has gone away. It's not like we're going to get to zero or necessarily have a big reprieve from having this virus in our population. And, there's going to be a number of factors that determine how frequent our waves are and how often they occur and how high they are. And, the best way of addressing that is, once again, those same simple measures to make sure the impact of each and every wave we're going to see moving forward.
Mask up and make sure you keep yourself safe. Thank you, Paul, very much for your time. I appreciate it very much.